My mom had cancer of the parotid gland. It's somewhere around your ear. My dad was diagnosed with cancer a day before I was diagnosed with breast cancer. He was diagnosed with melanoma.
My grandmother had cancer, but she was the only one. I think she had colon cancer.
I remember my oldest son, his grandpa passed away in May with a lung cancer.
I smoked about 20 years and probably a pack plus 3 a day.
And then in June, my dad passed away with the melanoma. And my son told me when I got sick again, like in August, September, he said, "Don't you die on me." He said, "I've had enough loss."
The gland here had swollen up, and I had no symptoms that I could tell that I was sick or anything. So he gave me some antibiotics, and it took the swelling down, but he noticed a little knot back here. And I told Zell, I said, "I think I got a problem." And it sure was a problem.
I fought cancer basically all the way until 02. What is this, 10? 08.
I had a biopsy done of that knot, and it turned out to be cancerous. So he recommended Dr. Bolger to me at Missouri Baptist Hospital, and Doc had a CAT scan, a CT scan, and it showed up small cell lung cancer in my left lung, which was 4th stage. He asked me if I wanted a second opinion, which we did take, and the 2 doctors in St. Louis at another hospital, they just give me 6 months.
But I could never get back to where I felt good. I was always real sluggish and tired, and that's when my friend Arlita told me, "Go see Dr. Epstein and get a second opinion." It was his first appointment. You always had to go all the way to St. Louis. He called me on Monday and said, "I need you back up here to put a port back in." And went back up, got the port put in, and started again. And I switched and I came to Sullivan for Dr. Epstein. He used to come out every Wednesday. 1 day a week, the oncologist comes out. It was like a godsend, where I didn't have to drive all the way to St. Louis.
One reason I couldn't take radiation is Doc said they move around so much we can't pin them or anything like that. So radiation was out, and I guess surgery was out then. He had mentioned to me one time on this chemo, so he said there's 134 across the nation taking this chemo. After hearing those guys and doctors in St. Louis giving me 6 months, I'll just try anything. And maybe it'll do somebody else some good later on.
It moved into my bones, not the bone marrow, the bone itself. And I had 2 tumors on my brain. Dr. Epstein, he went on to do research. Dr. Lee started working there too, and he took care of me.
Well, Dr. Bolger subscribed this trial, and he said, "You're in such good physical shape for your age." And at that time I was 70. We proceeded then with the chemo, which I had 6 treatments of chemo treatment once every 2 weeks. After 2 treatments, the knot back here disappeared, and he said, "Your cancer in your lung is really shrinking." And this February of this year, it finally turned out that this tumor was starting to grow again. So he took a biopsy of that in St. Louis at Missouri Baptist, and I had a CAT scan and a PET scan, and then we proceeded with more chemo, and in 2 more treatments it shrunk down again. So he said, "I think we're right on target with this," and so I took 4 more treatments, and the last time I seen him was a month ago, and he said, "I'll see you in 4 months."
When Dr. Lee finally told me, "I think you're in remission," but I had to go through 3 different series of cancer.
Good doctor, good nurses, good wife. It's just so convenient. I guess that's the main thing. And we're still getting the best of care.
I only come every 3 months. One of them's to get my port flushed, and then every 6 months I see Dr. Lee. Dr. Lee's just a wonderful person. He's very funny. He tells me every time I see him, if you don't feel good, you call me and get your hiney back up here.
The nurses have been just super nurses. Terry Brown, as I said, was my head nurse. And then there was Bridget and Gail. And everyone just is, caring as possible.
It's like family. It's like family. And we're not in a fight.
They're always encouraging the people, you know, no matter how bad their cancer is, and no matter how bad a shape they're in, they always seem like they got a good word for the people. It's just a good place to be. Makes you feel at home.
Missouri Baptist Sullivan Hospital. It's exactly 49 miles from my garage door. Some days whenever I would have chemo, I would be too tired to drive myself back. So I had to have someone with me to drive me up and drive me back. But to go on to St. Louis, oh, that would have been too much, I think. Especially whenever you're taking it every week.
Well, we're 10 miles from the hospital, and it's just a lot better to have it close instead of driving all the way to the city. And usually when you're done with the chemo, you want to go home and get some rest. You don't want to have to drive that 75 miles again.
It was a real benefit for me to come to Missouri Baptist Sullivan. If I were to win the lottery, I told the nurses that I would build them. I would pay to have it built, an outstanding oncology department. It would be larger, of course, so the family could come in with the patient and talk with them, you know, and read and just be there to help them through, keep their mind off what's going on. The one they have now, they have to sit in the waiting room because the recliners that you're in, they're about 6 inches apart.
You have to go to the restroom or something like that. It seemed like several people had to move their chairs so you could get through to go to the restroom, or you had to move your chair so they could get through. And they do need more room, there's no doubt about that.
And on a full day, I mean, it's crowded and noisy. I sat one day at the desk, the nurse's desk, and had my Zometa put in.
Sometimes that I've been down there, they was giving people chemo out in the hallways even.
Just more room and nicer chairs. It was a hard road. If I didn't have a sense of humor, I don't think I'd ever made it. I really don't think so. With my sense of humor and the Lord watching over me. Because I'd pray every night for the Lord to get me through it. Not heal it, but just to get me through it and get my family through it.
I've been off chemo now for 7 weeks, and I've just about gained my original weight that I like to carry since I've lost. So I'm right back up there again, cutting logs, cutting grass, giving people a hard way to go.
And with a new grandbaby coming, I'm starting on his quilt.
Never give up. Quitters never win. Winners never quit.